Welcome and thank you for joining us today. Today's webinar is presented by SeniorEmployees.com, your HR partner for an aging workforce. Today's topic is Medicare enrollment periods and penalties, what HR should know. A little bit about today's webinar, just a couple of notes here. We intend to keep the meeting to about 15 minutes long. We do our best, usually runs a few minutes late, but we know your time is important. We'll send out the presentation to all the attendees, so if you want to refer back to the content, that will be available to you. And then if you have any questions, please contact Bill Robbins after the webinar. Bill is our senior client manager, and he can answer any Medicare questions you might have. And if you're interested in some additional support from our company, we'd be happy to help you and explain how that relationship works. My name is Chris Quadrini. I'm the founder of SeniorEmployees.com. Been in the health insurance and Medicare platforms for over 20 years. And so hopefully our expertise can help you and your HR team make sure your employees are in a good position when it comes to Medicare. Now, today's agenda, we'll talk a little bit about Medicare eligibility, what you can do at age 65, or if you waive Medicare at retirement, other enrollment periods that could be important, and then potential penalties. We want to make sure we don't put our employees in harm's way. So who's eligible for Medicare? Well, if you've been in the United States for at least 5 years consistently, that's as a legal resident or a citizen, you'll be offered Medicare when you turn age 65. So for those of us that were born in the United States, worked at least 10 years in the United States, paid our Medicare taxes, or been married to somebody who worked for 10 years and paid their Medicare taxes, you'll be offered Medicare at age 65. Some citizens get it a little bit earlier. If you're unfortunate enough to have a disability and you qualify for Social Security disability income, you will get Medicare 24 months after you've been approved in that program. And for some of us that might be unfortunate with a more serious diagnosis of end-stage kidney disease or Lou Gehrig's disease, you will be given Medicare just a couple of months after that diagnosis. Now, the initial enrollment period is something we all should be aware of. When you turn 65, you will be eligible for Medicare in most situations. Now, Social Security will automatically start your Medicare for you if you are taking Social Security income prior to age 65. Now, you can turn that on as early as age 62. However, most people that are working are not going to turn on their Social Security income till their full retirement age at 67. So why is that important? If you're not taking Social Security income, I believe the government assumes you're working and you have access to group insurance, so they don't turn on your Medicare. And in this case, if you wanted Medicare to be active, you would have to actively enroll with the Social Security Administration. And so this timeline can be important if you want Medicare to know what you do to enroll. Now, if you waive Medicare at age 65, you can do so as long as you're working and covered under a group health plan for a company that employs more than 20 people. And if your spouse wants to keep the group insurance, she or he has the ability to do that as well, as long as you're working and have that group insurance. Dependents have the same rights. So when we look at this graphic, if we're looking at the months of the year, which works out because we're in April now, so that being the 4th month, if you're turning 65 in April, you can actively turn on your Medicare in January, February, or March, and the government will make it effective on the 1st day of April. If you miss that 3-month period, then you can still turn it on in April, May, June, or July. And if you do so at any of those months, it'll start the 1st of the next month. Now, if you're working and you have creditable group coverage, then this timeline isn't as crucial. But if you do not have creditable coverage and you miss this timeline, then you will have delays and potential penalties for not enrolling in Medicare. The only creditable coverage that the government considers is employer group health plans. So if you're not enrolled in an employer group health plan, you do not have creditable Medicare coverage. So your initial eligibility, you're eligible, like I said, when you turn 65 for most people. At that time, you can turn on premium-free Part A only. A lot of people do that because they're afraid of penalties. There's actually no penalties for Part A, but it is free, so oftentimes it makes sense to turn it on. However, we do want to be careful if you're Offering an HSA plan, employees that have an HSA bank account cannot make contributions to that bank account when Part A is active. They also cannot receive contributions from the employer to that bank account if Part A is active. So we want to advise our employees, if they like that HSA perk, not to turn on Medicare Part A at age 65. Now, at age 65, you can also turn on Medicare Part B. That comes with a premium, so most people are going to keep the group plan, are going to waive Part B. It wouldn't make sense in most cases to start Part B. It sits in the second position. Yes, it'll help in certain circumstances, however, probably not worth the premium. And then if you're a higher income earner, if you make over $106,000 as an individual or $212,000 as a couple, you'll have to pay more for Part B, so even less reason to turn it on if you're going to keep the group insurance in the first position. Now, you can definitely waive Medicare A and B when you have creditable group coverage and turn it on without penalty or delay when you retire. And the dependents who want to keep the group plan also have that same right. Employees do have a special enrollment period or a life-changing event to start Medicare at age 65. So if you have an employee, it's not your open enrollment period. Let's say it's the middle of the year, they turn 65. If they want to move to Medicare, they have the right to be let out of the group plan and move to Medicare. So that is something that you probably already know. Employees that work for companies with less than 20 employees must start Medicare at age 65. So if you're assisting or working for a company that has a smaller workforce, we need to educate our employees that at age 65, they have to start Medicare. Now they can keep the group coverage, but Medicare would be in the first position. The group coverage would be in the second position. Oftentimes, Medicare plans are going to be cheaper than the group plan, but it is a case-by-case situation. Now, if you want to keep working past 65, you are able to delay Medicare when you're first eligible, as long as two things are true. You're enrolled in a group health plan and your company has more than 20 employees, and that you or your spouse are working for the employer that provides the health insurance. That one seems a little more complex. However, there are some retirees that have a retiree package where they just keep the regular group health plan after they stop working. That is not considered creditable for Medicare. So you have to be careful if you're past age 65. If you're not working but are enrolled in a group health plan, technically your Medicare can come with delays and penalty if you do not enroll once you stop working. Now, you can start Medicare anytime after age 65, as long as those two things are true, that you're working and you have creditable group coverage. However, if it's not open enrollment period for the group plan, you might not be able to leave whenever you want. We know you can leave the group plan at age 65. However, once that life-changing event has come and gone, leaving the group plan oftentimes requires an open enrollment situation, but different companies handle that differently, and we can help you look at your options and what you can tell employees. Upon retirement, employees definitely need to know that COBRA is not creditable coverage. By law, they are offered COBRA when they retire, even if they are past 65 years old. Some people that don't educate themselves enroll in COBRA and later on see that they are going to receive a penalty. We want to be very clear with our employees not to accept COBRA and Medicare. Now, COBRA and Medicare can work together, but I would argue that almost 100% of the time, you just want to stay away from COBRA if you're over 65 years old. Now, if your Medicare benefits become effective before your COBRA eligibility, you can elect COBRA and it'll pay in the second position. And so, why would you pay for a very expensive COBRA? Probably doesn't make sense if it's going to be in the second position. If you don't have Medicare and you elect COBRA, but you're eligible for Medicare, COBRA could deny claims because they are paying in the second position. So if you don't have Medicare and you make a big claim, the insurance company might look into that and say, where's your Medicare? So again, staying away from COBRA altogether when you're Medicare eligible is probably the best rule of thumb. Now, if you are signed up for COBRA and then you do become eligible for Medicare, so if someone retires maybe at age 64, they take the COBRA, they turn 65 before that COBRA is going to expire. When they turn 65, COBRA is going to terminate on them and they're going to have to sign up for Medicare, which is a good thing because they're triggered to do what is appropriate to avoid future penalties and delays. Now, if that happens and spouses or dependent children are still on the COBRA plan, they can retain that coverage until it eventually expires. At the time that you retire, know that you have 8 months to sign up for Medicare. That 8-month rule looks like this. Employees working past age 65 who have delayed Medicare Parts A and B, when they retire, they have 8 months, which is a pretty big grace period to sign up for Medicare. This also applies for dependent spouses that are over 65 and have delayed their Medicare. So employees over age 65 when they retired will still be offered COBRA by law. They want to make sure that they don't take that 18 months of coverage because you can see that will end after this 8-month rule, leaving the employee in harm's way for a couple of reasons. One, COBRA might not cover claims if you're eligible for Medicare. And two, passing this 8-month rule will definitely come to you with penalties and delays when you want to start Medicare, because again, one last time, COBRA is not creditable coverage, and COBRA does pay in the second position after Medicare. Now, this general enrollment period shouldn't be something that you concern yourselves too much with, but for people that do not enroll in Medicare when they first have an opportunity to do so, are going to find that there could be delays and penalties if you don't hit your Medicare 8-month rule. If you're not working and you didn't start Medicare at age 65, and then you find out later that you need to start it, well, you can only start it between January and March each year. So if you find yourself and it's the middle of July and you need health care, you might have to wait 6-7 months before you can even turn your Medicare on. Once you turn your Medicare on, there could be a penalty if it's been more than a year without having Part B coverage. Once you do turn it on, though, that's when you can start a Medicare Advantage plan or standalone Part D plan. However, if you're going to do the standalone Part D plan, that usually is a strategy to coordinate with a Medicare supplement. If you're missing some timelines, you can find yourself in a situation where underwriting might apply for you to qualify for a supplement. And again, not knowing the timelines can put your employees in harm's way a few ways. So the best practice is make sure they have basic Medicare education and are understanding their strategy and their needs and putting a game plan together. Now, other enrollment notes that you should be aware of: Social Security automatically comes with a Part A enrollment if you're older than 65. Now, if you waive Part A at age 65 and you later ask for it to be activated, Social Security will automatically backdate that Part A 6 months. You might be aware of the rule that you should stop making HSA contributions 6 months before you turn on Medicare. The reason is Social Security always backdates your Part A 6 months. And so we want to make sure those contributions have already stopped. Again, not policed very well, so I wouldn't panic about it, but we do want to advise accordingly. So again, if you turn on your Social Security income, let's say you're going to keep working past 67, and you want that extra income because now you're past the full retirement age, you can do that. However, know that the government is going to start Part A automatically, and you can't waive it if you are taking the Social Security income. They come hand in hand, and that could have HSA considerations that we need to be aware of. Now, if you waive Part B at age 65, you can definitely get it back upon retirement or even before you retire, but you do need to prove to Social Security that you had coverage with a group health plan since the age of 65. And as an HR manager, you're going to be involved in that paperwork for Social Security. So you'll be asked to fill out a CMS L564 form for your employee. A couple of things that we see HR managers do incorrectly commonly is they don't backdate the health insurance coverage to age 65, even though the employee was covered by the health insurance. There could be a number of reasons for that. Maybe the health plan changed and there's a little bit of confusion of when the actual coverage started. We need to make sure, as an HR person filling out this form, if the employee was covered under group health insurance and working for the company prior to turning age 65, that we show on this form that those dates go back that far. If somebody tries to start Medicare Part B and they don't show they had health insurance coverage prior to age 65, Social Security will not start the Part B for them. And so we want to make sure we're not filling out paperwork multiple times, and hopefully that helps you. Again, if you take part of our services, we'll make sure all that looks good for your employees. Potential penalties. Part A is usually free to most people, and there are no penalties associated to Part A if you get it for free. However, if you come over later in life and maybe didn't meet that 40-quarter work history requirement for free Part A, you could potentially have a premium for Part A. If you don't start it when you're supposed to, then you're going to have a 10% premium penalty. Part A penalties will go away after a number of years, depending on your situation. However, Part B, for most people, is where they get into penalty situations that are harmful. You need to sign up for Part B when you're first eligible at age 65 or right when you come off group insurance. If you go a 12-month period without Part B when you should have had it, then you are going to be assessed a 10% penalty for each 12-month period. So if you leave it for a number of years, the penalty gets bigger. And how they assess that, they add that 10, 20, 30% penalty, depending on how many years it's been, to your monthly premium, and that penalty is for life. Part D also has a lifetime penalty. Now, Part D is a more common penalty because you have to actively enroll in Part D, and often people don't know that, especially if they're not taking any high-priced medicines. They might think they don't need a prescription drug plan. This penalty is a little more complex, but it works out to about $4 to $5 for every year you haven't had a Part D plan and should have. So if you go a number of years, it could be $5, $10, $15, $20 that they would add to your monthly premium. And again, that penalty is for life unless you're a lower income earner. Now, we kind of flew through that. Hopefully most of that was clear, but it is complicated, and we want to be there to support you and your company. So if you would like a little bit of education for your staff, we do Medicare Lunch and Learns. We bring you lunch. We now offer HRCE credits to your HR team, and so you kind of get a double win, free lunch and some CE credits. Why not? We do group educational seminars or webinars for your employees. So if you feel like educating your employees makes sense, and we certainly think it does, we can help you set that up in a formal situation. But we also do informal individual consultations as needed. A lot of our companies just refer us on a case-to-case basis. Someone turns 65, someone's thinking about retirement, and they want to just make sure they get the Medicare pieces right. You can hand them off to us, and we'll make sure they understand their group benefits, how that looks compared to Medicare, and point them in the right direction. We also offer real-time support. So if you have our contact information, you have a Medicare question, we also specialize in the Affordable Care Act. So for dependents or people that are retiring early that might need some individual or family insurance, we can also help you in those occasions. Most of what we do has no cost. So we would love for you to give us a call and learn about how we can help you and your company. Here's Bill Robbins' information one more time. Thanks for spending a few minutes with us. We appreciate your time and attention, and we are there for you when you need us. Thanks so much. Have a great day.